Bordetella is a highly contagious respiratory disease that pets get vaccinated for all the time. It can affect all kinds of animals like turkeys, pigs, rabbits, rats, and horses, but the most common are cats and dogs. If you have a dog, then you've probably had to take it to the veterinarian to give it a Bordetella vaccine. So what is Bordetella? At a microscopic level, Bordetella bronchoseptica, the bacteria that causes the very common kennel cough, is a small, rod-shaped, motile, in other words, capable of moving, bacteria that requires oxygen to grow. Bordetella causes inflammation of the trachea and bronchi, which can lead to a loud honking cough, thus the name kennel cough. Some other symptoms can include a runny nose, sneezing, loss of appetite, lethargy, and a low fever. The mechanism that Bordetella uses to invade the body is quite interesting. Bordetella attaches to the ciliated respiratory epithelium cells. These are the cells responsible for sending mucus up the airway. Then the Bordetella multiplies, or in other words, proliferates. Now that there's a large number of bacteria, the cilia, which are hair-like structures on the cells, will become paralyzed and the inflammation in the trachea and bronchi begins. Now the animal that is being used as the host is vulnerable to other pathogens, which can cause secondary infections and bring on even more problems. Bordetella is now surviving in the lower respiratory tract of the host and is also involved in the programmed cell death, or apoptosis, and the inactivation of cell signaling of other cells. The vaccine for this specific strain can be given by injection, orally, or intranasally, aka through the nose. The intranasal pathway allows for immunity to build in the mucous membranes of the nose, throat, and windpipe, which is where the bacteria colonizes and helps create a herd immunity. The vaccine can be administered every 6 to 12 months, which is what is recommended by veterinarians. It is debated in the veterinary community, however, how well the vaccine works due to the results of lab and field studies, which suggests that it is not as effective as we would like, but it is still highly recommended to receive, and most boarding facilities require it anyways. This is to help lower the chance of transmission from dog to dog. This was my presentation on Bordetella, and I hope that you found it informative.